Hello class, my name is Lauren Young and I will be presenting about lithotripsy procedure. Alright, what is lithotripsy? So in Latin, litho means stone and tripsy means crushing. So lithotripsy is about a 45-minute to 1 hour non-invasive procedure. So what is non-invasive? Basically, non-invasive is it doesn't involve cutting or breaking the skin. So to begin the procedure, the patient will be brought into the exam room. They will lie onto a table, and the importance of this table, it'll either be a water or gel-filled cushion, or it can be a tub submerged in water. The tub is less common. The more common ones are water or gel-filled cushion. This will help with administration of the shock waves. Next, once the patient is lying on the table, an IV will be started either in the arm or the hand, and the purpose of the IV is to administrate a sedative or anesthetic. Once the patient goes under sedation or anesthesia, a fluoroscopy or ultrasound machine will be used to locate the stone. Once the stone is located, the patient will be positioned to line up the stone and the machine. Once the patient is in position, the lithotripsy machine will administrate a series of shock waves to the targeted stone, and it will be guided by a fluoroscopy or ultrasound machine. And the purpose of having it be guided by ultrasound or fluoroscopy is to make sure that at all times the stone is lined up with the lithotripsy machine, and it is also to monitor the location and if the stone is being broke down into fragments. So as I mentioned, basically the purpose of this entire procedure is to take a stone, break it down into smaller fragments and pieces so that the body is able to pass it out through urination. And the shock that's administered can be between 60 to 100 shocks per minute, depending on the size of the stone. And per session can be 2,000 to 4,500 shocks per session. As I mentioned earlier, it's all dependable on the size of the stone, and you won't know until the procedure has begun. I thought this diagram, it's pretty basic, but I liked how it basically kind of showed what a room would consist of. So here you have a staff member monitoring the patient. You have the lithotripsy machine generating the shock waves to the targeted area. Here's the monitor to monitor the stone. And then also you have a lead apron for protection of the staff member. All right, what is a kidney stone? So basically a kidney stone is a hard mineral deposit that is formed in the kidneys that can either be found in the renal pelvis, ureters, or urinary bladder. It's composed of minerals and acidic salts that stick together when the urine becomes super saturated. So here we have this cartoon demonstrating the kidneys. Here's the ureters, both sides, kidney, ureter, bladder, and urethra. So the lithotripsy machine is going to submit those shock waves to the targeted area, break apart them in smaller pieces, and hopefully eventually pass through urination. The typical size of the ureter is about 6 to 8 millimeters, so anything larger than that or irregular in shape that isn't able to pass through the cylinder shape of the ureter will get lodged and stuck anywhere in the urinary system. So some type of symptoms that a patient may experience is sharp pain in the side of the back So typically, it's consisting of flank pain or lower back pain, which would be because it's in the kidneys area. And then this will cause painful or frequent urination, blood or cloudy urine, nausea, or vomiting. All right. What diagnostic modalities can diagnose a kidney stone? So you got a couple different modalities here. You have ultrasound, CT, MRI, and general radiography. So I thought this picture was pretty cool. Kind of shows you all different types of size and shapes and types of kidney stones. And then here's a ruler right here just to kind of show you the size comparable to it. And again, when the shock waves, let's say the shock waves are going to this kidney stone right here, it's going to break them apart into smaller fragments, probably smaller than these because these are still really big. But break them apart, and then the body's able to pass them naturally through urination. All right, so the first modality we have here is CT. You can see right here on this picture, the kidney coming down the track here in the bladder, and right there. And then this patient right here, we have it stuck right here in the kidney. And then, this is a abdominal CT scan demonstrating the kidney, ureters, and bladder of the patient. All right, the next modality that we have here is ultrasound. So ultrasound is a pretty preferred modality for this type of condition. It's preferred because it administrates zero radiation to the patient. So typically a pediatric patient is of choice for this modality. Also, too, I thought these pictures were really cool because, you're able to visualize the size of or measure quickly with some of the tools that ultrasound have. Immediately, right here, you can see the kidney stone in this top picture here. This is a sagittal cut of a right kidney. And then you have an abdominal here. Axial cut. You got two kidneys here. You can kind of see the kidney stone there, measuring at 4.7 millimeters on this patient. And this patient right here, another kidney stone at 0.5 centimeters. And again, this is a sagittal right kidney cut. All right. The next modality we have is general radiography. We're all familiar with this type of examination, a KUB. The patient lies supine on the table. We want to include the kidneys, ureters, and bladder here. Unfortunately, it's really hard to see the kidney stone with the naked eye here, especially with a non-radiologist monitor here. But you can kind of see it here on the left-hand side of the patient. What's interesting about this picture that I chose, this is a before and after picture of a patient receiving a lithotripsy procedure. Like I said, it's kind of hard to see because of the stool, but you can kind of see it here. And then it is gone on this side, so on the left-hand side, the patient had a kidney stone. So, all right. Up next here, and finally we have MRI. I thought this picture was interesting. It kind of goes through a series of cuts, an abdominal. Here you got the kidneys going down. You can see it, bang, depending on what cut you're in, you can see the kidney stone. So, all right. And before I wrap this presentation up, I kind of want to mention a little bit about qualifications for this type of procedure. So, not everyone is qualified for this type of procedure. Some contraindications for this type of procedure may include patients with a urinary tract infection, pregnancy, suffer from kidney disorders, heart issues, and so with that being said, the patient has to undergo a lot of intensive examinations. So they're going to go through blood work, urine analysis, a little physical examination to see if they're even qualified before receiving this type of procedure. And if the patient is qualified, they're able to go through this procedure safely. Of course, with every type of procedure, there is complications. One complication to be that majority is concerned with, and that is why patients are unable with kidney disorders and infections are bleeding around the kidneys. It's a major concern, and this procedure does involve high radiation dose to the patient. So along with pregnancy, it's kind of contraindicated with that. So, all right, that wraps up my lecture, but I have a couple quiz questions for you guys at the end here. All right, number 1. What are the 4 modalities used to diagnose kidney stones? Okay, you have ultrasound, CT, MRI, general radiography. Next question we have here is, what is the purpose of a lithotripsy machine? A, break apart kidney stones into smaller fragments. B, enlarge the kidney stone. C, the use of radiation to kill a kidney stone. D, all the above. All right, the answer is A, break apart kidney stones into smaller fragments. All right, third question we have here. What are 2 imaging modalities used during a lithotripsy procedure to locate and monitor the stone? The answer is fluoroscopy and ultrasound. And fourth question here. Point and locate the kidney stone displayed on the diagnostic image. Right. And we got the kidney stones right here within the kidney. Last and final question, true or false? Everyone is eligible for a lithotripsy procedure. If false, explain why. All right, the answer is false. Not everyone is eligible and will qualify for a lithotripsy procedure. Contraindications such as pregnancy, bleeding disorders, UTI, heart or kidney issues. Thus, the patient must undergo blood work, diagnostic testing, and a physical examination before qualifying. All right, that wraps up my presentation for the evening. I hope you guys enjoyed, and here's my references.